This episode of Let's Get Comfy was brought to you by Evolutionary Healthcare. Caring is what we do.
Welcome to another episode of the Let's Get Comfy podcast. I'm your host, Norman Harris, the CEO of Comfort Measures Consulting. I have a wonderful guest with me, a leader in the healthcare industry and a long-term care journeyman as well. And I always start our guests allowing them to introduce themselves. And to my right, I have
Joshua Wagner. I am with Aviata Health Group, and also I'm executive board member, senior vice president with the Florida Healthcare Association.
Yes, sir. Thank you for taking time out of your day to come join the platform, man. It means a lot to me.
I'm
overall.
excited to be here, Norman. Really excited.
Yes, sir. So, Josh, we're going to start this with you personally.
Okay.
All right. Tell us where you're from, your hobbies, what you enjoy doing, man.
Okay. So I'm actually a Florida boy,
Florida?
born and raised.
Yes, sir.
Grew up in Merritt Island, Florida. So born at Cape Canaveral Hospital back in Brevard County. So yeah. So I'm. This is my home state. So
Yes,
that's
sir.
where I'm from. But just grew up here, went to school here, stayed here, work here. It's just been great. So, but it's a great state to live in. It's been a great state to live in, and it really helped develop me.
Yes, sir. What led you into healthcare?
So honestly, I've always kind of wanted to be in healthcare. I actually wanted to go to school to be a doctor, and look how well that turned out.
Yes,
So, I went to school. My first degree was degree path was molecular microbiology, which was the pre-med path back at UCF, and
Okay.
just organic chemistry 2 was the hardest B I've ever gotten in my entire life. So, but that's kind of went there, and then honestly got a chance to talk to a lot of physicians and hospitals and stuff like that, and really just the changing nature of healthcare. And it's I think I'd rather be on the business and advocacy side. And so I kind of switched to Health Services Administration, and the rest is history.
Rest is history. So now you're a leader in Florida. If you would tell us, just give us, if we're in the elevator together, we're going to the 50th floor.
Okay.
Tell us just the last 10 years of your professional journey, right?
Yeah, so last 10 years. So the most recently with Aviata Health Group for a little under a year now. Prior to that, I was with Millennial Healthcare.
Okay.
And they operate in kind of Central Florida. And I've been with them, and I was doing senior executive director, kind of helping with running facility, but also help oversee other facilities, which was good. Prior to that, with Clear Choice Healthcare through COVID, spent some time with them in Orlando at Conway Lakes for a long time. And that was definitely an experience because just the whole COVID time was with them.
Well, yeah,
everything like that. So it was crazy.
Yeah.
It was definitely crazy. But that's kind of with the companies that I've been with. And then with Florida Healthcare Association, just really been kind of growing up in the ranks from being with committees, committee chair, running the annual conference committee, getting on the executive board. And it's just been a whirlwind, and it's been awesome. It really has been.
A true servant leader too.
Yeah,
So you've always been involved, and just to see the trajectory and how you grew is very inspiring to a lot of other leaders in long-term care. If you had a message to share with a future long-term care professional, just someone starting out their career, what would you say to them?
So get involved. We're loudest when we do it together. When we go together and we do the lobby Wednesdays, and we do inviting the representatives and the state senators to come to our centers and everything. That's when we're loudest, and that's when we really can make a big impact on doing stuff for our residents, for our staff, and really making sure that our care centers are getting what they need. And so get involved and ask for help. You need help? Ask. Florida Healthcare's here. You got people outside of your companies even that you can offer assistance. I always tell them, get involved early. You don't have to be on the executive board to get involved. Some of my fondest memories are working on the committees and learning more about how this profession works and the things to do and how to do it. And from there, kind of building your building blocks and go up from there, and move up from committee to committee chair to region VP to getting on the executive committee. And you can do it all. And it's rewarding because you really feel like you're giving back. You're able to see just the things we do and the voices we have and the impact it kind of trickles back down to the centers. And it's just amazing.
Right. So in your opinion, and if you would share with the audience, is what makes Florida a great place for retirement, but also a great place for care?
Okay. Well, number one, the weather. Yes, because it's beautiful in there, and the state's just a beautiful state. But I think really because there's, first off, I think you have some compassionate providers here, especially in our space, in the long-term care space. There's people that just, either whether they're transplants or whether they've grown up here or lived here for a long time, they're passionate about taking care of people and really making sure that the care they're getting is quality and amazing care.
Yes, sir.
And it doesn't say there isn't hiccups in the world, but like, we're people taking care of people.
Yep.
So it's always in a revolving, trying to get better, trying to reach that perfection that we'll never reach. But that's what it is. But when you have that, and then you have the providers who go to the state legislature and say, hey, we want to provide the best quality care. Help us do that.
Yes.
And then the legislature says, sure, let's do that and create that gold standard that we got going now that other states are copying, because they're seeing like, holy cow, look at this. Look what the state of Florida is doing. We're leading in so many different metrics in quality. I really think that, you have great leadership in the Florida Healthcare Association. You have great leadership in the state legislature and the state government. And then you have great leaders in the providers that are around the state.
All right. Thank you. That's actually really good. That's a good answer, too.
Yeah.
And you just said that off the top of your head.
I did. I
I
did.
studied that one. Yeah. So Aviata, am I pronouncing it correctly?
Aviata.
Aviata Healthcare.
Yeah.
You're leader with Aviata Healthcare.
Yeah.
Well, tell us about the organization, what's unique, what sets it apart as a company as a whole.
Okay. So Aviata, a lot of the buildings and centers in Aviata are the old consulate healthcare buildings, and some of the other smaller ones that were kind of broken off throughout. And we had our CEO and COO, Nathan Freund and Ami Dagan. They came in and wanted to start something here, and so we were able to get 58 buildings around the state to create this. And we started as Aspire Health Group.
Yes.
And then had a little snafu with the name and stuff. There's another company out there that has the name Aspire that wasn't too pleased because
I do like the new logo too.
Yeah, me too.
I love the new logo. Yeah.
So, but we changed the Aviata just to, so there's no issues with them and with us. But the parent company is still Aspire Health Group out of the Northeast. But Aviata. But yeah, I'm not gonna lie, I like the colors a little better too. The black and gold, I like it. I'm a UCF person, so.
You UCF as
Oh
well?
yeah.
Under construction forever.
Yeah, that's right. You ain't lying. Or you can finish too.
You can. Yes. So effective strategies and implementation in long-term care. And I want to do a scenario here.
Okay.
As a leader in healthcare, if you had a facility struggling, right? With Aviata Health Group, right? You took over a new facility, you purchased a new facility,
Right.
You guys are growing. What do you guys process in regards to when you actually purchase a facility and from a clinical improvement standpoint?
So a lot of it's going in and just kind of going in and seeing what's already there. You want to see what we got going on. Do we have the right systems in place? Are we doing the things we need to do on a daily basis? In honesty, do we have the right people in the right positions?
Right.
Sometimes, there's a little disruption that has to be made, whether it's from the top down to the bottom up, either way, or both sides even. And you really got to just evaluate it. And you can't just go in there and make a knee-jerk decision and hope it's going to fix it. Like you have to spend the time. I'm a big believer in the 30, 60, 90-day kind of process. You kind of observe and watch for 30 days. 60 days, you start to put some new stuff in. And then 90 days, hey, we're here. Let's start making the changes.
Yeah.
Kind of stuff. And I think Aviata does a good job of that. We took over some struggling buildings that, had some quality issues.
Yeah.
And, it's going to take time. The group itself, the company itself has only been around less than 2 years.
Wow.
From Aspire to Aviata, even with the name changes, less than 2 years. So there's a lot of stuff they've achieved in 2 years.
58 buildings.
You ain't lying. That's a big ship to turn.
Big ship. Yes,
big
sir.
ship to turn. So it's a lot, but there's you can already see where there's some positive improvement going. And, we got buildings that are leading the way that are 4 and 5 stars. And then we got buildings that are, we're 1 star and now moving up 2s and 3s. And it's huge. And it starts with quality. It always does. And that's where there's a huge focus on the quality and the clinical outcomes that we're providing, making sure the care that we need to give those residents is the correct care. And that's the biggest thing.
Yes. So, Josh, I'm telling you, you come off very competitive.
Oh.
Right? Very competitive.
Yeah.
So, are you competitive?
I'm very competitive.
All right.
I don't like to lose.
Give me an example. It doesn't have to be professional related.
I grew up playing sports a lot.
What sport?
So I played baseball, football, basketball, ran track, played soccer a little bit as well. But yeah.
You got a J?
So, I used to. It's been a while since my son schools me now. But
what player in the NBA would you compare your game to?
That is a really good question.
Derek Fisher, Steph Curry,
I'm a scrapper. I'm a scrapper. I'm a
Okay,
scrapper.
so Richard Jefferson.
Probably. Like I like to get I'm gonna go get the loose ball.
Got it.
I'm gonna go do the hard foul.
Who's else like that?
I'm trying
Doug
to.
Christie.
Yeah, that's not a bad name.
Like that.
That's not a bad
Richard
person.
Jefferson.
Yeah.
Artest.
Yes, our test.
Metal
Yeah,
World Peace
that's
now.
probably a good one. Like I'm gonna do that. I'm a scrapper. Like I'm not the biggest guy.
Yeah.
Wasn't the tallest guy. Plus plus my
You gonna
skin
work
color.
hard, though.
Skin color. You gotta make up a little. Can't jump aside. Can't jump aside. But no, you gotta do that kind of stuff.
Now,
So
how do you actually being competitive?
Mhm.
How do you incorporate that in your leadership style?
So for me it's I look at it as you always want to there's friendly competition with your sister facilities, we'll say. So there's all of that friendly competition and you always want to be the best. I feel like because if you are the best, you're delivering the best care.
Yes.
And that's kind of how I look at it. So I kind of look at it that way. The metrics that we use from CMS as well as from the state of Florida for the quality stuff, looking at that, because what I always say is, especially with employees, to really dial it down for them. Be like, guys, like if we do these things,
Yes.
the incentive for the pay for the residents to make sure we can give them even better care is there.
Yeah.
And so I use that a lot. And they get that. They understand that. They can say, oh, so if we give like amazing care, we can get more back for our residents so they can get more stuff. And exactly. And that's kind of what I kind of dial it down for them a lot. And then, what's great is I feel like healthcare itself, there's a lot of competitive people. You just got to find your staff members and you kind of put them in charge of things. Be like, hey, you're in charge of this. And like, I always do like an employee engagement team where the actual staff members run it. I'm just there for moral support and make sure they're doing this stuff. But I want them to have ownership in that and, breed that competition there. And
build an engaging culture because everybody can find problems and issues.
Oh,
right?
yeah.
Who's going to join the team, right? The fun squad committee.
Exactly.
Who's going to join those committees and make the change. Right?
Exactly. And oftentimes they create those competitions like, hey, Unit A versus Unit B about, the less falls or the who could be the cleanest rooms or whatever it can be, And we even do fun things like we'll do wheelchair races, or we'll do who can make a bed faster and stuff like that, or make the cleanest bed or whatever. Can I bounce a quarter off that thing?
See?
That's how it is.
I knew you were competitive.
Yeah, heck yeah.
So this show is definitely about speaking to the caregivers, sharing knowledge and resources.
Definitely.
But so if you had a message, one, do you have a personal story to share regarding caregiving, but also a message to families and caregivers out there today?
So so I kind of grew up in this industry. I actually didn't think I'd be here. And like I said, I wanted to be a doctor initially, and actually my first job after college was in a hospital. I worked in hospitals and didn't want to do this. My grandfather did this for many, many years when I was growing up, and he ran assisted living, he ran nursing homes, he ran independent living facilities as well. So I grew up running around these places, and I'm like, I don't need to do that. No. And really, I was in the hospitals and just it's like it's not personal. It felt it's cold, it's sanitary, kind of thing. And my grandfather said, well, he always wanted to push me toward that, and he said, hey, come talk to this guy that I know. And I didn't know who it was. He set up a lunch for me, and it was a CEO of a company that had CCRCs in Florida, and it was this lunch. It wasn't a job offer, it wasn't anything else. And he said, my grandfather didn't show up. It was just me and that CEO. And he was like, hey, he goes, I hear you're interested in doing something different. And I said, yeah, I actually am. And he spent we were 2-hour lunch talking about the things his company did, the residents in his centers and his communities, and just the wonderful things they can do. And it kind of lit a fire a little bit. And it really sparked something. And he said, hey, if you're really interested, he goes, the next following year, we're going to have an AIT opening up. And I said, why not? And I did it and just fell in love. I remember my first week in the skilled center was just a whirlwind, but it was so much fun. It was just a blessing. And it's not something, like I said, I thought I would ever do, but it just, I found my passion.
You find your passion.
And it was just, it's amazing. And I get emotional talking about it, but it's just,
you connect
it's
your
cool.
Purpose with your passion.
I do, man. That's what it is.
That's a big thing.
It's great.
A big thing. It took me, I really believe I did that at the age of 34. So I'm a little later in the game of connecting my purpose with my passion.
Definitely.
But it's a beautiful thing when you do, man. Then your work is no longer just work.
Right.
right? You enjoy getting up in the morning. It's not a pain to go to work. I mean, of course, we'd rather be
Oh yeah,
millionaires,
of
billionaires,
course.
but even those individuals work,
Yeah, they do.
so they stay busy. So
They do.
I'm gonna start a little drama here on the show.
Oh, a little
today,
drama.
a little
Okay,
drama.
okay,
All right, so and this may have a little backlash on you. All
okay,
right,
okay,
if you could give 3 shout outs here on the show today.
okay.
3 shout outs. It don't say I want to give all my team members a shout out.
Fair enough.
3 shout outs. Yes, sir.
Okay, and it could it be my company or anybody? Doesn't matter.
Anybody.
Anybody.
Yes, sir.
Okay.
Don't go personal because then I want to offend your family or anybody like that. So let's stay professional.
Stay professional.
Let's stay professional.
Fair enough.
Yes, sir.
Okay.
Mhm.
3 shout outs.
Mhm.
I will give a big shout out, especially right now, to Tom Parker and Toby Philpott.
Yeah.
Just the work they do. I've been blessed to be, hand in hand with them and really see the things they do behind the scenes.
Mhm.
And it is amazing work that what they do and how they step up for our centers, for our people, for our residents. And they just do a bang up job. And this year was a tough lift. It was a tough lift this year, and they got it done. And
I think Tom told me he about to participate in like a 100-mile run or something like
oh
that.
yeah, he always does that kind of
I'm
stuff.
like, what?
That- that-
100 miles?
You talk about being competitive. That boy is competitive.
Jesus
So,
Christ.
but no, the two of them are great. I will say Deb Mack, who is my chief nursing officer for my company Aviata. Just an amazing clinician. Just being I didn't know her well until I joined the company, and just talking to her and getting to know her and the people around her and the things she has done,
Yes.
and like just how well respected she is. She is a rock star, is all I can say. And I
Deb
just
Mack.
yeah, Deb Mack. She's good people too. Just a fun person to be around. But she's great and just always willing to lift people up and just build good teams and find the right people for the right places. And that's just great. I'll see if I can do one more. Norman, I'm actually going to say you, my friend.
Really?
I am I remember when you started doing this, and I heard about it, and I was like, who podcast?
Yes, sir.
I was like, who? But when I more thought about it, I was like, that's an amazing thing for us to do. How a better way with how many podcasts are out there about everything under the sun,
Sir.
but there really wasn't one for us. And you're really taking that by the horn and really running with it. And I think it's amazing. And when you told me there was an opportunity, I was like, let's go.
I saw you when you responded to a comment
Yeah.
on LinkedIn. I said, oh yeah, he's gonna be on the show at the
Yeah.
Florida Healthcare for
Heck
sure.
yeah.
And so I told Kristen Knapp, I said, I want him on the show for sure. So it really feels good to have people champion that
Yes.
and actually publicly embrace it too.
Yes.
Because I get a lot of people walking by,
Yes.
Norman, I love what you do. That's fine. I love it.
Yeah.
I accept it all. Please continue that too. But just the embracing and those likes and shit. I've never been a social media person.
Right.
So now I'm like fading into like, oh man, they didn't like my post now. So now I'm like becoming this social media, watching those things now. So it does mean a lot. And I challenge the audience out there, subscribe to the show,
Yeah.
tune in.
Yes.
I know in most time, leisure time, myself included, I like to watch funny things. And before I
course.
know it, I'm sitting there on the couch with my daughter watching TikTok, little kid funny videos
Right.
for an hour. And they like to watch people eating. I say, why you want to hear people crunching and smacking for? But I always challenge people to tune into things that will actually benefit you.
Yes.
You hear from experts that actually journey through healthcare
Right.
and you don't typically have access to.
Right.
Right. And I heard one of my mentors told me, she said, tune into what you want to turn into.
That's a great saying.
I said that I did that too. And
Man.
that changed a lot of the landscape, what I listen to in the car now.
Right.
Those things, tune into what you want to turn into. So I want to be able to prepare my family from healthcare situations.
Right.
I want to be that person in my family that people can call and say, hey man, mama going through this and can you help me?
Right.
You could be that person in your family. You can have your family ahead of the game, knowing the power of attorney, having that situation,
Right.
knowing mama health insurance, where her social security card is.
Yeah.
Those type of questions, you can have answers to it now.
Definitely.
So, and that's what I wanted to do for a community because, as you know, in skilled nursing, people go and sit with admissions or social services and they don't know where to start.
And they have no idea what's going on.
No,
and
they
it's
don't.
not clear. Like you said, it's not. And
Mhm.
having an advocate like you doing
Yes,
that and really
like-
can boil it down to the people is huge. It really is. And and having someone who can really help us bridge that gap and really kind of change the culture and change the mindset of the things we do in our profession is amazing. We're always looking for those people, and you're one of those people, Norman.
Thank you,
You
sir.
are, my friend.
Thank you.
So
Final
I love it.
words as we wrap up today.
Final words.
Yes, sir.
It's been a great conference already.
Yes, sir.
It's we got a couple days left. I feel like every year we do bigger and better here, and it's amazing.
Beautiful too.
Oh
here at
yeah,
the
the Hyatt. It's
Yes,
great.
sir.
It is great. We're back at the Rosen next year. it's so much fun. We can get all these people together. It's like old home week. It's like a reunion, at the time. Alumni coming back is what it is. And it's just so much fun to get everybody here. And you get your passion back, I feel like, a lot. Because so often I feel like we go through the every day of the surveys and, the difficult things we have to go through, because oftentimes we get people the worst part of their lives.
Right.
And, and we're the ones that have to build them up. And I feel like coming back here and getting with the people that you work with hand in hand every day kind of gives you that fuel back to really get that fire going again.
And then it's mid-year too, so it's like your rejuvenation to finish the year. But thank you again, sir, for joining the platform.
Thank
I'm
you.
so happy to have you. Thank you to our sponsors, Evolutionary Healthcare, Hyatt Regency here in Orlando.
Wonderful.
And most of all, Florida Healthcare Conference and Trade Show. Tune in to the next episode. Thank you.
Thank you.
All right.
Thanks, sir.
Man, you killed that.
Thanks, man.
This episode of Let's Get Comfy was brought to you by Evolutionary Healthcare. Caring is what we do.